Good morning, DPM Heng. Again, thank you very much for inviting us to this dialogue session today. So I felt that I need to speak on behalf of the senior population, given the fact that we are actually an aging population. So my name is Swee. I'm from a charity with IPC status called Blossomseeds, with the plans to plant seeds for everyone to blossom, including the seniors. Yeah. So basically for us, we have two parts to our program. Our home-based program, we bring seniors for medical appointments every day. So the seniors that we saw, a lot of them have critical conditions, chronic conditions, and then their life is all about visiting the hospitals and then nothing else. So for us, what we do on top of that is we try to bring them out for events and other excursions, so that their life is not just about medical appointments. And on the second part, we just moved into our first center at Sembawang, and over there we noticed that there's a lot of seniors with caregivers of dementia, patients, Parkinson's, spouse, and all that. So at our center, and some of them, they have chronic conditions as well, and they have not been working for a while. And over there at our center, we try to engage them by giving them a platform to contribute. So we made them to become our center befrienders to look after other seniors.
Sorry. What is your question?
So the question I have is twofold. So the first question I had is, how can the care for senior be less clinical? So like my medical trip is funded, but anything else that I do other than that is not funded. You know, for example, but we felt that it was important, so we carry on doing all that so that the seniors have a more holistic care. And the second part to my question is, I benefited from working with the sick and dying at a very young age of 20. And it took me 10, 20 years to prepare my parents for their old age and for their dying. So my question is, how can Singapore better plan for our next wave of seniors? You see, not just myself, but even like how can we be better prepared for aging? Because I realized that this generation, a lot of the seniors that we saw, they were not prepared for their aging issues, you know, be it physical, mental, emotional issues. Right. So a lot of them had a lot of baggage. But how can we better prepare our young people now for their aging in the future?
Okay.
Thank you.
All right, thank you. And your question, please?
Good afternoon, DPM. My name is Deborah Koch, and I'm 17, currently studying at Singapore American
Sorry, can you speak closer to the mic? We can't really hear you.
Hi, my name is Deborah Koch, and I'm currently 17, studying at Singapore American School. I'm the president of United Singapore, which helps to promote local foreign integration among youth, and I'm also a onepeople.sg youth advocate. And my question is regarding the youth in Singapore. Youth can be very passionate about certain causes, and I wanted to ask, how can we further encourage youth in Singapore to take initiative or even start initiatives in order to help address their concerns? Thank you.
Okay.
In order to
address their initiative, their concerns and...
yeah. Okay. So first on Siu Chin's question, let me thank you for doing this very meaningful work and taking care of the elderly, you know, for so many years. You started when you were very young. And your question is actually a very critical one, because you see our seniors, the number of people who are above 65 and above will increase from about 450,000 today to 900,000 by 2030. And 2030 is just 11 years away. So we are going to be one of the most rapidly aging societies in the world. I know Minister Gan Kim Yong has spent a lot of time looking at what we can do across different settings, from healthcare to family care. And he's looking at a whole transformation of our healthcare system, what can be done for us to provide better care. And at the same time, Minister Josephine is working on the idea of a productive longevity. A few months back, I went to Japan to study what they were doing, because Japan has one of the highest aging rates in the world. And what Japan has done is, for instance, in the area of work, they have found that people who work, stay healthy, because there's something to look forward to every day. There's a whole circle of friends and colleagues that they can continue to interact with. It's not such a sharp change of lifestyle. So we are looking at what can be done for us to think about retirement age, and keeping our people healthy and active even as they grow older. We started this project on a community network for seniors I mentioned in my speech earlier that Kim Yong will be continuing to drive this. And this is 80% of our population lives in HDB flats, and at the void decks, they can come together to participate in the whole range of activities among neighbors. And that is very easy, simple, and accessible to everyone. So we have to continue to look at some of these measures that we need to take, and it will be one of the areas that we are going to discuss with Singaporeans and with all the organizations, VWOs, hospitals, and so on who are involved, on how can we achieve this target of this goal of productive longevity, and that the work is not just about looking after healthcare, looking at hospitals. On your specific suggestions on the medical subsidies, I will ask Minister Gan to have a look at it. Yeah.
But what about, because very often we are promoting active aging, but now she's saying, how do we prepare them also for what is the possible outcome,
right.
Death and growing old?
Yeah. So that's another part of the work indeed, that it is one of those events that we can, none of us can escape from. So looking at how can we allow, enable individuals to pass on peacefully, and it's something which we must continue to look at. I've spoken to some of the volunteers in our hospices, for instance, and they shared also important lessons of what we can do for individuals. So it's something that we must continue to talk about. Then on the last question by Deborah from